Warning: sensitive content.
Our programs offer many languages. Please visit suprememastertv.com/schedule.
Experts say that a common popular misconception is that by surviving a previous infection means one is COVID safe from recurring infections. Downplaying COVID-19's hazards could have serious repercussions on one's long-term health. Vegan, the solution to steer away from the pandemic spiral, Part 3 of 4. Continue watching to find out more.
Come to make war so you'll never see any sign of heaven.
Manaon means hello in Malagasy, one of the official languages of Madagascar. Intelligent viewers, my name is Esti. The elegant people of Madagascar pray that the vegan lifestyle brings long-lasting peace to you and all the co-inhabitants on this planet. Welcome to Vegan, the solution to steer away from the pandemic spiral, Part 3 of 4. In today's show, we will look at some of the adverse health effects of COVID-19 and talk about the reasons why the coronavirus should not be underestimated for the sake of our long-term wellness. Hospitalized cases climbed quickly following a wave of Omicron subvariant BA.5 in the United States and Europe. BA.5 has evolved with some key mutations that can help it escape from the antibodies induced by vaccines and prior infection. Dr. Ziad Al-Ali, a clinical epidemiologist and a professor at the Washington University School of Medicine in St. Louis, United States, and others conducted a study on health risks of a COVID-19 reinfection based upon the health records of 5.6 million persons in the United States. The risk of death for people with reinfection was 2 times higher than those infected once, and reinfected persons were 3 times more likely to be hospitalized within 6 months of their last infection. Furthermore, researchers found that the findings also held true for people with or without COVID vaccinations, showing that the vaccines did not lower the risk of the detrimental effects of COVID-19. Experts say that a common popular misconception is that by surviving a previous infection means one is COVID safe from recurring infections. Downplaying COVID-19's hazards could have serious repercussions on one's long-term health. Using data from the U.S. Department of Veterans Affairs that included more than 250,000 people who had tested positive for COVID-19, researchers found that reinfected persons have a greater risk of many new health conditions, including cardiovascular issues, blood clots, kidney disorders, gastrointestinal problems, mental health issues, musculoskeletal and neurological conditions, diabetes, and fatigue. These adverse effects could persist for an extended period of time. A recent study in 2022 suggests that those infected by the Omicron variant have a 24 to 50% higher chance of having long COVID than those infected by the Delta variant. Brain fog is one of the common brain-related symptoms described by patients with COVID-19. It is a general term for various symptoms affecting cognition and memory. Brain fog includes problems with concentration, memory, and decision-making or planning, as well as mental confusion, sluggishness, and fatigue. A systematic review study found that 43% of people globally with a prior COVID infection have experienced symptoms of long COVID. Those who were infected with the virus have a 77% higher risk of experiencing brain fog. Scientists do not have a clear answer as to how COVID causes this condition. One theory is that the coronavirus creates pervasive inflammation and an immune response that impairs normal functions in the brain. According to a comprehensive analysis of federal data, researchers at the Washington University School of Medicine studied patients' brain health over a year-long period. The study found that people who test positive for COVID-19 have a higher risk of developing neurological conditions within the first year after infection. Some of the neurological issues include movement disorders, memory problems, strokes, and seizures. The number of infected individuals with neurological conditions is higher than that of those without prior infection by 7%. By applying this percentage to the U.S. population, this would be equivalent to around 6.6 million people who have had neurological impairments caused by the virus. On April 11, 2022, our most beloved Supreme Master Ching Hai Vegan called Supreme Master Television team members to check on their well-being and graciously shared important information about COVID.
So many effects. They will never discover them all.
Yes, ma'am. Yes.
And it might appear in another kind of sickness, so they will not think it's the after effect of Omicron or COVID-19. Just like brain damage like that.
Yes.
If we don't have such good scientists who found out, then they would probably think this guy had just gone crazy or something, or brain damage for some reason, or genetic, or just sickness.
Yes.
Yes.
They would not know it's from COVID-19. Some they know, some they think it's just a disease.
Yes.
Yes.
Many strange diseases happen and they cannot explain already. Many. Well, at least a lot, at least several. But they did not think it was from COVID-19. It's all from COVID-19.
Yes.
Yes.
Oh, God. Just because they could not find out, so they did not think so.
Yes, Master.
After COVID-19, many strange diseases are happening to people in different countries. And they can't find out, they can't explain.
Some slay animals for sacrificial purposes. Some kill animals for the sake of their skin. Some kill them for the sake of their flesh. Some kill them for the sake of their blood. Thus, for the sake of their heart, their bile, the feathers of their tail, their big or small horns, their teeth, their tusks, their nails, their sinews, their bones, with a purpose or without a purpose. Some kill animals because they have been wounded by them, or are wounded, or will be wounded. He who injures these animals does not comprehend and renounce the sinful acts. He who does not injure these comprehends and renounces the sinful acts. Knowing them, a wise man should not act sinfully towards animals, nor cause others to act so, nor allow others to act so. He who knows these causes of sin relating to animals is called a reward-knowing sage. Holy Akaranga Sutra, Jainism.
We will pause a moment for a constructive message and be right back to hear more about the adverse effects of COVID-19. Please stay tuned to Supreme Master Television. Welcome back to Vegan, the solution to steer away from the pandemic spiral, Part 3 of 4 on Supreme Master Television. A research team from the University of Cambridge and Imperial College London has warned that around 400,000 people who have long COVID in the UK may be affected by cognitive impairment, with some possibly never recovering. Harmful effects of a coronavirus infection can linger for more than 6 months after contracting the virus. Even if patients recover from a severe case of COVID, they could suffer the same cognitive aging that people go through between the ages of 50 and 70, equivalent to a loss of 10 IQ points. The emerging evidence of the long-lasting impact on mental processes is worrisome. Some children can develop serious conditions after contracting COVID-19. One significant complication is MIS-C, which is an abbreviation for multi-system inflammatory syndrome in children. Dr. Matthew Harris, a pediatric emergency medicine physician, described the cases he received at Cohen Children's Medical Center in Long Island, New York. These are some of the sickest children I've seen in my career as a pediatric emergency medicine attending. Dr. Harris added, they often require cardiovascular support because MIS-C causes inflammation of the heart called myocarditis. MIS-C occurs 2 to 6 weeks after a COVID infection and affects multiple organs such as the skin, gastrointestinal system, heart, lungs, eyes, and brain. Although symptoms of MIS-C can vary, they usually include a fever with symptoms such as skin rash, bloodshot eyes, diarrhea, vomiting, stomachache, dizziness, and lethargy. According to a meta-analysis study published in April 2022, in about 14% of COVID cases, a potentially fatal condition called acute respiratory distress syndrome, or ARDS, can occur. People with pre-existing medical conditions, such as diabetes or hypertension, are more susceptible to ARDS. Fluid enters the lung air sacs, thus making breathing difficult and lessening the body's vital oxygen supply. Numerous studies estimate that nearly 70 to 80% of COVID-19 patients will experience a wide range of complications. One of them is pulmonary fibrosis, a long-term condition. it raises great concern as it changes the lung structure and impairs the organ's function, resulting in decreased quality of life. Currently, there is still no proven treatment for post-COVID-19 pulmonary fibrosis, apart from antifibrotic drugs to reduce the severity of the injury. According to the World Health Organization, or WHO, as people are coping with the physical, social, and economic impacts from COVID-19, their mental health has also been greatly affected. A large number of individuals have reported mental health issues, such as psychological distress, depression, anxiety, and post-traumatic stress disorder. Deteriorating mental health has led to suicidal thoughts and behavior in some. In early August 2021, Candice Davis of Pennsylvania, USA, a 30-year-old flight attendant for Republic Airways, tested positive for COVID-19. After 2 weeks in quarantine, Ms. Davis's condition quickly declined. Experiencing high fever and irregular heartbeats, she was rushed to the hospital. Her blood pressure plummeted due to a heart infection, so she had to be put in a medically induced coma with a ventilator and extracorporeal membrane oxygenation machine to serve as her temporary lungs to keep her alive. Experts believe that the SARS-CoV-2 virus is the cause of the damage to the interior lining of her blood vessels. This led to blood clots and the blocking of the blood flow to her extremities. As a result, one arm above the elbow and the other below the elbow, along with one leg below the knee and half her right foot, had to be amputated to save her life. Candice recalled what she saw when she woke from her coma. Seeing my arms and my feet super black, dead, they told me. We've got to amputate your arms to keep you alive. When they amputated my left leg, that's when I really started to get emotional. The blood clotting complications from COVID can cause other serious life-threatening conditions, such as heart attack, deep vein thrombosis, stroke, and even multi-organ dysfunction. Candice Davis's case is just one of the many, reflecting the hidden dangers of COVID-19.
Some of the COVID-19 symptoms and vaccine-related side effects: paranoia, arrhythmia, post-traumatic stress disorder, renal failure, myocarditis, hypertension, obsessive-compulsive disorder, dysphoria, mood disorders, throat pain, stroke, dizziness, lymphedema, sputum, diabetes mellitus, discontinuous flushing, diarrhea, pulmonary fibrosis, red eyes, psychiatric illnesses, chills, sleep apnea, reduced pulmonary capacity, sleep disorders, intermittent fever, palpitations, resting heart rate increase, weight loss, digestive disorders, depression, anxiety, hearing loss or tinnitus, memory loss, chest pain or discomfort, nausea or vomiting, sweating, cough, joint pain, pulse-activity polypnea, anosmia, ageusia, dyspnea, hair loss, attention deficit or hyperactivity disorder, headache, fatigue, abdominal pain, phantasmia, parosmia, dysgeusia, delirium, swollen lymph glands, tremors, pericarditis, Guillain-Barré syndrome, capillary leak syndrome, transverse myelitis, immune thrombocytopenia, blurred vision, seizures, menstrual irregularities, etc.
Humans will need to make a collective shift to adopt a vegan lifestyle to halt the current pandemic and prevent more zoonotic diseases from arising that are caused by animal people factories and the destruction of ecosystems. Let us pray that all around the world quickly realize the devastating impact of COVID-19 and soon return to their true compassionate nature by turning vegan to save our future generations.
Don't make peace, cause the devils will hate you for it.
Kind viewers, thank you for your company on today's program. Please join us again on Saturday, November 12th for Vegan, the Solution to Steer Away from the Pandemic Spiral, Part 4 of 4, when we will examine the broader impact of COVID-19 from social, economic, and political perspectives. Up next is Make Peace with Animal People, Turn Vegan, Make Peace with Humanity, No More War, Part 3 of 6, on Between Master and Disciples, right after noteworthy news. May the light of heaven shine upon you and bring eternal bliss.
Our programs offer many languages. Please visit suprememastertv.com/schedule and suprememastertv.com/show.
Nos programmes offrent plusieurs langues. Veuillez visiter suprememastertv.com/schedule et suprememastertv.com/show.
Nuestros programas ofrecen varios idiomas. Visiten suprememastertv.com/schedule y suprememastertv.com/show.
ਸਾਡੇ ਪ੍ਰੋਗਰਾਮ ਪੇਸ਼ ਕਰਦੇ ਹਨ ਅਨੇਕ ਭਾਸ਼ਾਵਾਂ। ਕਿਰਪਾ ਦੇਖੋ suprememastertv.com/schedule ਅਤੇ suprememastertv.com/show।